Hi friends, welcome back to my channel. Today we will discuss about the dural venous sinuses. You all know the brain is covered by means of meninges which are having three layers. The outermost layer is the dura mater, the middle layer is the arachnoid mater and the innermost is the pia mater. In fact, all layers are having two layers separately. If we see this is the interior of the skull. The outermost layer is the dura mater, and that meninges has having two layers. Outer endosteal layer, which is lining intimately to the inner aspect of the skull bones. It is even penetrating into the sutures, so it is tightly adherent to the bone. That is why this is called endosteal layer. And the inner layer of the dura mater is called meningeal layer, which is present adherent to this layer, but at some regions it is separated from this layer, leaving spaces. So this is the meningeal layer. This meningeal layer forms folds. One fold is the falx cerebri between the cerebral hemispheres, falx cerebelli between the cerebellar hemispheres, and tentorium cerebelli between the cerebrum and the cerebellum. And one more fold is there, the diaphragma sellae, which is covering the sella turcica of the sphenoid bone. Then the inner layer, inner to this meningeal layer, is the arachnoid mater, which is the outer layer is attached to this layer, and inner layer is attached to the outer layer of the pia mater. There is a subdural space between the dura mater and the arachnoid mater. The pia mater is having outer epipia and inner pia glia. The epipia attaches to the inner layer of the arachnoid mater, and the pia glia closely adheres to the surface of the brain. The space between these two layers, that is the epipia and pia glia, is called the subarachnoid space, and which is filled by the CSF. This CSF gradually flows into the spaces between these meningeal layers, which are the venous sinuses, and then it is being absorbed by the arachnoid granulations. Again it is reabsorbed there. So these are the foldings of the dura mater. And now we come to our main topic, the dural venous sinuses. I already told you there are the meningeal layer of the dura mater forms few folds between the hemispheres, and within the folds there are endothelial lined spaces which are called the dural venous sinuses. There are many dural venous sinuses within the skull, and few of them are paired and few of them are unpaired. We will see the unpaired list first. Unpaired are the superior sagittal sinus, and inferior sagittal, then comes occipital, straight, anterior intercavernous, posterior intercavernous, and the basilar venous plexus. Now, in this video, we will cover all these things. Then the paired ones are transverse, sigmoid, cavernous, superior petrosal, inferior petrosal, petrotympanic, spinoparietal, and middle meningeal, so middle meningeal sinus. So these are the unpaired sinuses. And these are the paired sinuses. Today we will discuss about the unpaired sinuses and few details. We will start with the superior sagittal sinus. You all know the fold between the two cerebral hemispheres is the falx cerebri. So, the falx cerebri is attached from the crista galli to the roof of the tentorium cerebelli. So, it appears like this. So, it appears like this in sagittal section. If we see in coronal section, if this is the skull bones, if this is the endosteal layer, now the meningeal layer appears like this. So, in the coronal section, the same falx cerebri appears like this. This is the fold formed by the meningeal layer between the two hemispheres here, cerebral hemispheres. So, in this fold, in this region, we will see a triangular shaped space lined by the endothelium. This is the superior sagittal sinus. So, that appears like this. Like this. So, this is the superior sagittal sinus. And at the lower border of this fold, we will see another small sinus which is present from almost the middle of this fold. This is the inferior sagittal sinus. This is the inferior sagittal sinus. So, these are the two sinuses here. This superior sagittal sinus starts behind the crista galli and it is running along the superior margin of this fold and reaches the internal occipital protuberance, where it turns to the right side by forming the right transverse sinus. It forms the right transverse sinus, which is in the tentorium cerebelli, which is in the fold of tentorium cerebelli, which is like this. So, this is the attached margin of the tentorium cerebelli and this forms the right transverse sinus. So, the superior sagittal sinus continues as right transverse sinus, and if we see, it gradually increases in its width and size, and at its posterior end it is dilated here, which is lying a little bit right to the internal occipital protuberance, and this is called torcula hierophili. That is the confluence of the sinuses, torcula hierophili, and this receives the veins from the superficial or superior part of the lateral aspect and medial aspect of the cerebral hemispheres. Those are called the superior cerebral veins. These are the superior cerebral veins, and it also will have the projections of this subarachnoid from this arachnoid membrane will form arachnoid granulations, which project into the lumen of this sinus to absorb the CSF. There are 3 lacuna. If we see from above, if this is the superior sagittal sinus, there are 3 lacunae present on either side of it, one in the frontal region, one in the parietal region and one in the occipital region. So, 3 lacunae are present. In this section we will show one here. This is a lacuna into which also sometimes the arachnoid granulations presents. So, this is the lacuna is present there. These lacuna receive meningeal veins, that is from the meninges, and diploic veins. The diploic veins are from the diploic tissue which is present within the skull bones. So, it receives blood from the meningeal veins and the diploic veins. So, these are the meningeal vein, this is the diploic vein. At this end, sometimes this superior sagittal sinus may receive a vein from the nose through the foramen cecum. So, it anastomoses with the arteries within the nose, through which the thrombosis may enter the superior sagittal sinus. In this region, it receives the parietal emissary vein, which joins this superior sagittal sinus to the veins of the scalp. So, parietal emissary vein will join here. So, these are the tributaries of this superior sagittal sinus. Sometimes there is a superior anastomosing branch of the superficial cerebral vein which connects this sinus to the cavernous sinus. So, that is a superior anastomosing vein of Trollard. Which connects superior sagittal sinus with the cavernous sinus. Now, coming to the inferior sagittal sinus. So, it is present in the sagittal plane, both are. So, this starts from the posterior 2/3 of the fold and it gradually goes down, and at the attachment of this falx cerebri with the tentorium cerebelli, it continues back as straight sinus. So, this is the straight sinus which is coming here, and that straight sinus turns left to form the left transverse sinus. So, this is the straight sinus which is going left to form the left transverse sinus. The tributaries of this inferior sagittal sinus are the veins from this falx cerebri and few veins from the lower part of the medial surface of the cerebral hemispheres. And this straight sinus, now coming to the straight sinus, it is the continuation of the inferior sagittal sinus, and it receives at its starting point the great cerebral vein of Galen. This is the great cerebral vein of Galen. Great cerebral vein of Galen. This vein is formed by the union of two internal cerebral veins. So, and it also receives blood, venous blood from these meninges, and few veins from few cerebellar veins which are present under this part, and this will present a communicating vein to the torcula. Now, you can see the superior sagittal sinus, the right transverse sinus, the straight sinus and the left transverse sinus are joined. So, this is called confluence of sinuses. The occipital sinus starts from the margin of the foramen magnum and it ascends up posteriorly to join the torcula here. So, this is how the occipital sinus goes to the foramen magnum. So, superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, 4 sinuses are covered here. So, these are all unpaired sinuses. Now, if we see the cavernous sinuses of both sides, they are present on either side of the sella turcica, and they are present like this in this fashion. The details we will discuss in the next video. Both cavernous sinuses are joined by means of an anterior and posterior. This is the anterior intercavernous sinus and posterior intercavernous sinuses. Two sinuses will connect both cavernous sinuses, and thus a circular sinus is formed around the sella turcica, which is lodging the pituitary gland in its middle. If we see, these sinuses are connected by, this is the inferior petrosal sinus, this is the inferior petrosal sinus. Of both sides are connected by the basilar venous plexuses. These venous plexuses anastomose with each other and they continues down through the foramen magnum with the internal vertebral venous plexuses. So, these are the basilar venous plexuses. So, total superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernal sinus and posterior intercavernous sinus and basilar venous plexus. These are the unpaired venous sinuses present within the cranial cavity. Now, the paired cavernous sinuses, the paired dural venous sinuses we will discuss in next video along with the details of cavernous sinus. Thank you very much. You can ask any queries in the commentary section, and please like, share and subscribe my videos. Thank you.